South Africa's national health insurance is in the spotlight. Economic health consultant and CEO of Usizo Advisory Solutions, Dr. Anuschka Coovadia, says the NHI is widely misunderstood. She says it's a fundamental component of the country's economic and social transformation. Coovadia spoke to ENCA's Yuveka Rangappa earlier.
I firmly believe that the national health insurance is a fundamental component of our economic and social transformation in South Africa. Healthcare and education really are the building blocks of a successful society, and as we've seen over the last decade, many developing countries that have been liberated have really achieved this through developing a sustainable healthcare system that can keep their populations healthy and allow their people to achieve their optimal potential in terms of employment and contribution to their society.
Now, just looking at what you've had to say about it, and the common thread is, yes, somebody somewhere is going to have to make some kind of sacrifice, and that is going to be, and make some kind of adjustment to how they usually go about receiving health care. Am I correct in that assumption that, yes, it's going to take sacrifice on the part of some, and it may not be very comfortable in the beginning or for the first couple of years?
Absolutely. A lot of people think that national health insurance is about creating a payment pool or a funding pool, hence the term insurance. But the real impetus behind a successful national health insurance is changing the way healthcare is delivered to the population, which involves the doctors, the nurses, the pharmaceuticals, the hospital groups, and anybody else who's involved in the provision of healthcare. In South Africa, as you're aware, we've got a very robust, entrenched private healthcare sector that really provides a higher standard of healthcare that is enjoyed for the majority of the population who rely on the public sector. Currently, our populations are divided between two very, very entrenched systems. And in order for us to transition to a more unified, equal system, there is going to be a lot of collaboration, integration, and a lot of trade-offs that need to be made on both sides of the system. I really believe that the path towards universal healthcare coverage is fundamental for the future of our country, and it is going to require providers to do things differently, to work differently with each other, and to try and engage around a unified system rather than this very divided, fragmented system we currently have.
And let's talk about what could be the possible stumbling blocks, Doc. I mean, one of them, and the big question has been raised, is what happens to medical aids? What happens to the private sector? That's been a big bone of contention when it's come to NHI. So let's look at what would be some of the stumbling blocks, what might actually prove to be challenges as we get on the road to this, if and when we do.
So I think we, like any other country that wants to implement universal healthcare coverage for their country, and really the term universal healthcare coverage is probably the most important term. It essentially means that we provide healthcare for all our citizens, and no South African citizen has to endure financial hardship. There are some significant stumbling blocks that every country faces, including South Africa. And perhaps one of the largest stumbling blocks is the financial resourcing of this massive, massive, massive scheme. It really takes a lot of investment in terms of infrastructure, human resources, technological capability, clinical capabilities, medicines, etc., to be able to provide adequate coverage and care to 55 million people. A number of other countries are also trying to extend the number of their population that are brought into coverage, and it's a huge, huge investment that a country has to make. So I think the financial resourcing of the system is a challenge. Sustainability of the system is a challenge from a financial perspective. And many countries that have entrenched healthcare systems and universal healthcare coverage are also battling with the financial sustainability of their system. Besides financial sustainability, you need adequate human resources to be able to service the system. So the the benefits that are offered through this insurance system really are not worth much if you don't have doctors to see the patients, nurses to care for the patients, physiotherapists, dentists, etc. So the human resources of the National Health Insurance System are equally important, and there's a tremendous gap that we face in terms of the number of doctors, the number of specialists, the number of nurses, etc., that we have and that we need to provide coverage to the full country. And the third very critical challenge...
Do go on.
Sorry. The third very critical challenge we face is that healthcare is highly politicized. The structure and the nature of healthcare really is at the heart of politics in every country, and we can see it playing out today. So I think one of the greatest challenges we face is the need to make sure that the trajectory we follow from a health perspective is not influenced by the cycles we face in terms of the political structure of our country.
And Doc, very quickly, it already seems that we are battling to even get off the starting block here, because, I mean, we're still wondering whether Cabinet actually did reject the bill last week. We were told that all is well. We still actually don't even know. I mean, even at that stage, even at this stage at the moment, it seems that there's so many question marks over it. So not a great start at the moment, is it?
I think if we look at the snapshot of where we are right now at the end of 2018, a lot of people in the sector and in the industry feel very despondent, and there are high levels of anxiety and frustration. But I think if we step back and think about where our country is today compared to where we've been a decade ago or 3 or 4 decades ago, I think that we've made tremendous progress. There's a lot happening on the ground that the National Department of Health are implementing and is really impacting people at a grassroots level. Yes, there's a long way to go, but there are a lot of changes that are currently being implemented for the better. And the engagement and the discourse and the debate that's happening at a national level around healthcare issues is greater than it's ever been before. And for me, that is motivating, it's inspiring. It shows that healthcare has been elevated to a top priority for this country. We're seeing academics, we're seeing civil servants, we're seeing the citizenry all engaging around issues related to our healthcare system. And I believe this is the force that's going to ultimately drive the type of affordable, high-quality system that South Africans deserve.